Hello everyone. This is my introduction to the mini study analysis table. My problem that I'm looking at for my research review is what effect does maternal diet have on the prevalence of premature rupture of membranes? The reason for my topic selection is, for one, pre-labor rupture of membranes and preterm delivery cause the most amount of adverse maternal and neonatal outcomes. There must be ways that we can avoid this happening and in turn avoid a majority of adverse outcomes. And personally, I have seen a pattern of PROM moms in my area, and I'm just curious on the causes and ways to prevent these occurrences so that we can avoid the majority of these adverse outcomes. The studies that I have reviewed are as follows. Number one, the study is called Intakes of Garlic and Dried Fruits are Associated with Lower Risk of Spontaneous Preterm Delivery. The second one is the relationship between macro and micronutrients intake and risks of premature pre-labor rupture of membranes in pregnant women of Isfahan. And the third is the efficacy and safety of vitamin C administration to women with history of premature preterm rupture of membrane in prevention of such event in current pregnancy. Here are the study design and results for those three studies. So for the first one that is talking about garlic and dried fruits, the study design is a population-based pregnancy cohort study. And the conclusions and results are as follows. The foods with antimicrobial properties such as garlic and dried fruits are successful at preventing preterm birth and premature pre-labor rupture of membranes. There was a pretty significant p-value for garlic and its effects in lowering the overall risk of preterm delivery, whereas there was also a pretty significant p-value for the efficacy of dried fruits in lowering the overall risk of preterm premature rupture of membranes. The second study is the effects of macro and micronutrients on PROM and preterm delivery. And the study design for that study is a prospective cohort study. And the conclusion and results are the mean value of reported select nutrients consumed during pregnancy. There were specific foods consumed during specific trimesters as well that were found to have a higher correlation to PPROM compared to those that did not consume these nutrients during the specific trimesters. And the third study was the efficacy of vitamin C administration, and that study design is a randomized controlled clinical trial. And the conclusion and results for that study is that vitamin C supplementation increased the gestational age at rupture of membrane with a pretty significant p-value. It also increased the gestational age at birth, and it increased the birth weight for the babies that were born after a vitamin C supplementation. The strengths and weaknesses of each of the studies were, first, the garlic and dried fruit study had a weakness of the data that was collected from questionnaires are dependent on the accuracy of the information being reported, meaning that the people who filled out the questionnaires are only as accurate as they can recall their diet during pregnancy or during the days that they were surveyed for. But the strengths of that study is that it looked at many other factors that could also cause preterm delivery and influence the outcomes. So they were saying that these results might not just be related to garlic and dried fruits, but there are other factors that could influence these outcomes. The second study on the macro and micronutrients, the weaknesses is that the data on dietary intake was done based on a 48-hour window, which only gives room for error and could cause skewed data. And the strengths for this study is that the medical charts were filled out and reviewed by medical professionals who guarantee their accuracy. And the nutritional data that was received was analyzed through a nutrition IV software. And the third study, which looks at the efficacy of vitamin C administration, had some weaknesses, such as the sample size is small at only 100 participants, but the results were still pretty significant despite the small sample size. And the strengths was that other data was also gained that could influence individual risks, such as parity, age, disease, BMI, gestational age at previous PROM, and preterm delivery. So it looks at the overall picture that could influence the results, not just saying that vitamin C had the full influence on these results. And here is my entire mini analysis table for these 3 studies. And thank you for taking time to listen.